Welcome back. Today in our East Jefferson General Hospital medical moment, Camille Whitworth visits with an experienced OBGYN physician, Dr. Michael Graham, and gets his thoughts on the profession and the exciting future for women's care at EJ. Take a look.
As a woman, part of your overall health includes going to the gynecologist. And here at East Jefferson General Hospital, the team here has a clear vision of what the gynecological department is doing and where they're going in the future. Today, we had the opportunity to speak with OBGYN Dr. Michael Graham. He talks about his passion for what he does and what's happening here at the hospital.
Most of us, when we go through residency, you don't pick your specialty. You think you're gonna, but you don't. The specialty ends up picking you. And so I liked the combination in obstetrics and gynecology that you do surgery, you take care of patients, and it's a mixture of both. So you get to know people. So to me, being just a surgeon, you only see people for 5 minutes and they leave. When you do obstetrics, you get to watch a whole family grow. And I mean, that to me is the beauty of our specialty. You see generation after generation, you know, as they grow up.
So you see babies having babies having babies.
I think I'll make it to that third segment, but I'm not sure. I'm trying. I can't see quitting. A lot of people, when they get to where I'm at age-wise, start to cut back on obstetrics. For me, that's the real fun part. I really enjoy the delivery portion. When you're watching people become so excited about their baby coming out like I was when my children came out, that's a perk. You have to get paid because it's a job, but that's one of the perks and the gifts that we get as obstetricians, is seeing that happen.
What is it like for you bringing life into the world?
To me, every time it's pretty much a miracle. It's a pretty neat thing. If you look at what goes on and what has to happen in order for, you know, us to make another person, it's just amazing that it happens. And the wonderful thing for women, I think, is that nature made you guys like Timex watches. Y'all can take a licking and keep on ticking. If men were having babies, we would croak. It would be over with.
It's so exciting. You've been in practice now for more than 30 years, but you have a new home here at East Jefferson.
Yes, I'm very excited about it. I'm really happy. I think this is going to be a whole new adventure, and I look forward to, you know, continuing my practice over here and even building more and working with the other doctors that are here.
And one thing that's for sure, women's care is really important here at the hospital.
I always believe that I would rather have the doctor who has a lot of clinical experience over just paper knowledge. Paper knowledge is very valuable, and we need to have it, but the younger doctors today, I think they need to have experience from those of us who have been in the field for years in order to see how we apply it clinically. Because what's in a book and what a patient does, a lot of times it's two different things. Patients' bodies don't follow the book. And so you have to learn how to think outside of the box. And one of my biggest pet peeves was that they have all these algorithms they have to follow. And they asked me, what's my algorithm? And I said, it's in my brain. I just look at the patient and we treat the patient. And I think some of that's getting missed today because of technology. And the clinical experience of touching your patient, talking to your patient, when in doubt, examine your patient, that to me is the most important thing to do.
One thing I've noticed, you really put your heart and your soul into the care that you give to your patients.
Yes, well, I think it shows because I enjoy it. You know, I told my kids as they grew up, you have to find a job you love to do, and it needs to be fun when you go to work. Yes, it's work, and it's hard, and it's long sometimes, but I still enjoy getting up every day and coming to work. In fact, you guys remember last year we had a couple ice days where everything closed down, and I was home for 2 days, pacing the house. My wife told me if I go into retirement, she's getting a job because she can't have me pacing the house at home.
You need to work. You need to work, Dr. Graham.
I enjoy working.
As they stand now, things are great here at the hospital, but you envision a very bright future.
Well, right now, the great thing about East Jefferson is, you know, our CEO, Mr. Parton, and his COO, Mr. Zambito, their vision is for this hospital to continue to grow, especially in the OBGYN department. So then you're bringing new, younger patients into the system, and that's what we need to have for this hospital to continue to be as great as it is.
The relationship between the patient and the OBGYN, of course, it's very special, and it continues to grow over the years. So to find the gynecologist that's right for you, go to our website, ejgh.org. I'm Camille Whitworth. Thanks for watching.
All right, thank you, Camille. And yes, you can see the dedication and passion of Dr. Graham. As always, visit EJGH.org to learn more about all of the services at East Jefferson General Hospital.